So you may have heard that due to the COVID-19 pandemic, there's actually a new special enrollment period. That special enrollment period is going to last from February 15th to May 15th. So today we're going to walk you through the process to hopefully make everything a little bit easier. Stay tuned. Welcome back to our channel. So if this is your first time here, my name is Sarah, and I'm here today with iHealthBrokers to give you a walkthrough of Healthcare.gov. So as I said before, due to the COVID-19 pandemic, there's actually a new special enrollment period that's going to last from February 15th to May 15th. So if before you signed up and you picked the wrong plan, or you missed the enrollment period and you didn't get a chance to sign up, this is great news for you because it's basically a second chance. So we're going to do a walkthrough of Healthcare.gov, but as always, we really recommend that you work with a broker. A broker is a third-party liaison who works for you, not the carrier, which is the insurance company. So if you call the carrier directly and you work with an agent, of course they can only present you with their company's plans. They're not going to give you other companies' plans. But when you work with a broker, they can help you comparison shop multiple different plans, multiple different carriers. Makes the whole process a lot easier and usually a lot less expensive. Healthcare.gov can be a little bit confusing, not the website itself, but when you look at all those plans, sometimes it can be overwhelming. But we're going to try to help you out with that in today's video. Now, if you'd like our help, you can reach us here at iHealthBrokers at 888-410-0344. There's absolutely no charge for our services. There is no fee that you have to pay up front, and there's no fee hidden in your monthly premiums or anything like that. So if you'd like somebody to sort of handle all the nitty-gritty details for you and make sure that you really are getting the right plan for your needs, please make sure to give us a call. All right, so now I'm going to grab my computer, and through the magic of video editing, you're going to see what I'm seeing up on the screen. You ready? Okay, so first we're going to go to Healthcare.gov, that's Healthcare.gov, and this is the site where you can explore all the different plans offered in your state under the Affordable Care Act. Now, based on your state, it actually may redirect you towards your state's individual website because some states do have their own websites. And while we're on the topic of that, I do want to mention that some states are actually offering slightly different special enrollment periods. So Colorado, Connecticut, Massachusetts, Minnesota, New York, and Vermont, the special enrollment period is slightly different, so make sure to check with your state. Unfortunately, Idaho is not offering a special enrollment period at all. And then there are a couple of states that are only allowing uninsured people to enroll during this special enrollment period. So the other states are allowing you to change a plan as well if you already have insurance. But these states are only allowing uninsured people to enroll. So those would be California, Colorado, Connecticut, Maryland, Minnesota, Nevada, Rhode Island, Vermont, and Washington, D.C. Okay, so let's get back to Healthcare.gov. So I'm actually going to take you over here to where it says See Topics. And I want you to click on See If You'll Save, because it's going to do things in a slightly different way. Okay. So it's going to ask you some basic questions to see if you qualify for a tax credit. So let's say there are two people living in my household and I live in Alabama. Now look at this. It's going to give me income ranges. Okay, so here's why I wanted to take you to this page, because basically it's always going to work the same way. If you click that first bracket, it's going to talk about Medicaid, basically, which means that you may be eligible for Medicaid. So you may want to try to enroll in Medicaid. It's not going to say that you're automatically eligible for Medicaid because there are some other factors to take into consideration, but basically it's saying that you may qualify. Now, if I click on the second drop-down option, it's going to say you may qualify for a marketplace plan with lower monthly premiums, plus extra savings, including lower deductibles and co-payments. But to get those extra savings, you must enroll in a plan in the silver category. We're going to talk about that in a second. Now, if you go to the third drop-down option, it's going to say you may qualify for a marketplace plan with lower monthly premiums. It's not offering you those extra savings based on your income, but you're still going to get that tax credit on your monthly premiums, which is going to significantly decrease the price. And then there's the last drop down, which is going to say you're not going to qualify to save on an insurance plan. Now, the reason that I wanted to take you here is because I want you to see these different brackets, okay? Now, of course, that's going to change dependent upon, how many people are in your household and whatnot. But basically, I want you to see these brackets because there's a lot of people that are sort of on the cusp of qualifying for a tax credit or qualifying for that additional extra help or whatever. So what you want to do is look at these brackets, and if you are close, then you want to figure out how to get your income into that range that will make you eligible for a tax credit, because it's going to save you, I kid you not, thousands of dollars on monthly premiums, or it may save you thousands of dollars, but it's going to save you a lot of money, basically. So at that point, you may want to think about contributing to an HSA, get a high deductible health plan with an HSA to knock your income down a little bit, or if you have an IRA, maybe you can contribute a little bit to that. You may also want to talk with an accountant and just see what you can do to knock down your modified adjusted gross income, which we're going to talk about in another video. So while I'm mentioning it, please make sure to subscribe so that way you stay up to date when we release that video, because this is a modified adjusted income that we're talking about. So you may be able to basically apply some deductions that can make you eligible for these tax credits. Okay, so let's click on this one because I want to talk about the silver plan and those extra savings. Okay, so I'm going to click submit. Let's preview this plans. Okay. We're going to switch states, 330. Tell us about you and your household. Skip this. We'll say yes. Will you claim any dependents? Yes. Let's say we're going to claim 2. All right, let's say I'm a 35-year-old male. I'm a legal parent, not pregnant, not a tobacco user. Continue. Tell us about your spouse. All right, let's say a 32-year-old female who is also a legal parent. Continue. And let's say we've got 2 kids, a 2-year-old boy who's obviously not pregnant or a tobacco user, and 4-year-old girl. Sorry, bear with me as I just enter some random information. All right, now let's say we make All right, so I've entered an income and a household size that's going to give us the premium tax credit plus the extra savings if you pick a silver plan. So now let's see the plans that are available. It's going to tell you that you're going to get quick definitions, filtering plans, select plans to compare. Next. Okay. Fast facts. So your bronze plans are going to be usually your least expensive option as far as your monthly premiums, but your deductible may be higher and your copays or coinsurance may be higher. Then on the other end of the spectrum, we have the platinum plans. So it's going to have the highest monthly premiums, but lowest deductibles and lowest copays and coinsurance. This is basically always the way it goes. Your insurance is going to get paid one way or another, and it's either through your monthly premiums that you pay, or through the cost sharing. So if you have a lower monthly premium, you're usually going to have higher deductibles, higher coinsurance, higher copays. If you have a higher monthly premium, you're going to have a lower deductible, lower coinsurance, lower copays. So it's really important that you understand your needs, because if you're somebody, maybe you have small children, or you have a chronic condition of some type and you have to go to the doctor more frequently, then it may actually behoove you to shell out that money for a plan with higher monthly premiums, but lower copays, lower coinsurance, lower deductible, because that may actually end up saving you money in the long run. Now, if you're somebody that's a younger, maybe a single person who's relatively healthy, who doesn't go to the doctors frequently, you don't have young children, you don't have chronic health concerns, then maybe you want to go with a plan that has lower monthly premiums, but higher deductibles, higher copays, higher coinsurance, because maybe you're not taking advantage of the services as frequently. This is why we always recommend that you go with a broker, because there's just so many variables, and something may seem less expensive at face value, but it can end up costing you in the long run, which is why we recommend that you work with somebody who this is their field. That way they can guide you towards the right plan for your needs. It is not one size fits all. All right, so we're going to click See All Plans. 132 plans available. Wow, that's a lot to peruse, huh? So let's look at filter plans. Okay, let's say I know that based on my monthly budget, Gold and Platinum, they're just out. They're just too expensive on a monthly basis for me to be shelling out, which is totally reasonable. You know, you do have to consider your monthly budget. Okay, so, oops, actually, I'm going to do that the other way. Let's get rid of those. Okay. And let's say the absolute most that I can pay on a monthly basis for health insurance for a family of 4 is $950. Okay, let's apply these filters. Still a lot of plans available. We still have 104 plans available. So now we're looking at our different options. So as I said before, bronze plans, lower monthly premiums, higher deductibles. I wonder if there are any silver plans on this page, just so I can show you quickly. Let's see. We're still in bronze. Okay, but you'll notice here, so this bronze plan, higher monthly premium, lower deductible. All right, let me just show you a couple of things. Here's all the different, the plan name, right? Here's some star reviews. Now, sometimes you'll have a plan that's a brand new plan, so it won't have any reviews just yet. You're going to see this plan doesn't have adult dental or child dental. I would say, now obviously a lot of us are looking for certain fringe benefits in our health insurance, but try to make the decision based on your core needs, because you can always get add-ons as far as vision and dental, and actually dental insurance private dental insurance is much less expensive than people think it is, so you don't necessarily want to pick a plan for the fringe benefits, so to speak. So this plan actually has a $0 deductible, which could make it a good option for you, especially if you have young children, because that means you're not going to have to pay anything completely out of pocket, basically, before your insurance starts to take over with the cost sharing. You'll notice it's an HMO. HMOs and PPOs do tend to work differently. We talk about that in our HMO versus PPO video. Here's another plan with a $0 deductible. So let's say I want to compare a few of these plans. All right, let's say. Here we go. Let's compare this one with a $0 deductible. That's an HMO. And let's compare this one here with a $12,000 deductible. Let's find something totally different to compare as well. Okay, let's compare this one. I'm going to go up here and click Compare 3 Plans. Alrighty, so here's 3 very different plans. Monthly premiums. It's showing you what your tax credit is as well. Deductible, so this $0 deductible. $6,000, $12,000 for the family, $7,000, $14,000 for the family. You can also see if you already have specific doctors that you like to see, or you have prescription drugs that you're taking, you can click on this and make sure that your doctor and your prescription drug is covered by this plan, which I'd highly recommend. Costs for medical care. Okay, so here's the difference. We have an HMO here, so there's no benefit covered if it's out of network, whereas in the other plans, if you were to go for a PPO, which actually I didn't grab any PPOs, but if you were to go for a PPO, then you would have some coverage out of network. It's going to show you cost of x-rays and diagnostic services. Okay, so none of these offer hearing or eye exams for children. So this one, so no charge, no charge, no charge. Because there's a lot of services. Remember, there are essential benefits under the ACA, the Affordable Care Act. So even if you pick a plan that has a higher deductible, there are many services that are still covered before you hit your deductible, and many services that are covered at no charge before you hit your deductible. Very, very important. Oh, and this is what I mentioned before. So none of these are considered high deductible health plans or HDHPs. So none of these are eligible for HSAs, which are health savings accounts. You can only get a health savings account with an HSA. Health savings accounts get a lot of buzz in the financial independence world and the FIRE movement and everything because of that triple tax benefit. Yes, we've got a video all about that as well. But if you are looking to lower your income so that you can become eligible for a plan with a premium tax credit, then you may want to look into a high deductible health plan that comes with an HSA, because when you contribute to an HSA, you're going to lower your taxable income, which therefore may push you into a bracket making you eligible. Okay, so here it's going to tell you what costs for some prescription drugs might be. So remember, over here, this plan was our least expensive option as far as our monthly premiums. And look, generic drugs, $28. Now, these plans were more expensive, $3 or $10. See the difference? But I've got to be honest, when you look at it, it's still very confusing, right? It's still very confusing. This is maybe the first time you've noticed a big difference in favor of these two plans as far as the price is concerned. And this plan has a prescription drug deductible. Okay, so this is really important. Your deductible, as a reminder, is the amount that you have to meet out of pocket before your insurance kicks in. Sometimes insurance plans will have a separate deductible for prescription drugs. Very often, the prescription drug and the basic health insurance deductible are all roped together. So for these two plans, your prescription drugs that deductible is included in your health insurance deductible. So basically everything that you pay is going towards that deductible. For this plan, you first have to reach that prescription drug deductible before your health insurance is going to start covering your prescription drugs. All right, so none of these are PPOs. This plan, you're going to need a referral to see a specialist, though, and these plans you won't. As a reminder, that's a big difference between PPOs and HMOs. HMOs, you have to have a primary care physician, a PCP, and they will have to coordinate any visits to specialists. This can be a little bit difficult because sometimes that means an extra day off work, an extra doctor's appointment, and a little bit more of a headache. People tend to enjoy PPOs for the flexibility, even though they may be a little bit more expensive as far as your monthly premiums are concerned. there's hospital services. Oh, cost and coverage examples. Okay. So here's some major differences. Typical cost for a healthy pregnancy and a normal delivery. So the first plan, your typical costs are going to be significantly less expensive than these other two plans. However, typical yearly cost for managing type 2 diabetes for one person, wow, this plan is definitely the way to go, huh? Typical cost for treatment of a simple fracture. Okay, so this one I would sort of count out because obviously you don't know if you're going to have a fracture in the near future. But things like this, like maybe you know that you're planning on getting pregnant this year. Well, then maybe you want to go for a plan that has more coverage as far as pregnancy is concerned. Maybe you know that you or somebody on your plan is dealing with managing type 2 diabetes. Well, maybe you want to go with a plan that's got more coverage as far as that's concerned. Again, that's why we always recommend that you work with a broker, because you can tell them exactly what your health concerns are, so that way they can guide you towards the right plans for your needs. Obviously, you don't know if you're getting a fracture. Dental coverage. Some plans have dental coverage. Sometimes you can add them on at the end, but I wouldn't worry about this too much because, like I said, private dental insurance is not that expensive, and you can elect to enroll in that pretty much year-round, and there's a lot of options available. Then there's child dental coverage. Again, some of the plans are going to offer it, but it falls under the same rules that I just mentioned. You can always enroll in private dental insurance. It's not that expensive. Okay, some other services and medical management programs. Chiropractics. Infertility treatment, so it's not covered by any of these, but if it was something that was important to you, then maybe you want to pick a plan that has that. And just looking at these plans alone, again, that was 132 plans to go through. It's a lot to weed through. Mental health. Scrolling back up. All right, let's say I like this plan. Well, that's basically it. So like I said, I wanted to take you through sort of this backdoor way of doing it rather than creating an account and logging in, because I wanted to show you those income brackets. Please subscribe because we're going to be releasing a video on how to estimate your income for health insurance shortly. You want to make sure that you're estimating accurately because you want to not leave any money on the table, but you also don't want to underestimate, because if you do that, you may have to pay those tax credits back come tax time, and that is not a welcome surprise.
So that's basically it. Now you have until May 15th to get your plan confirmed, but like I said before, we always recommend utilizing a broker, especially one that doesn't charge. So hopefully you have a relationship with someone that you trust, but if not, you can give us a call here at iHealthBrokers at 888-410-0344. And as always, if you have any questions, anything like that, please feel free to leave them in the comments below, and we will absolutely do our best to help. I know health insurance can be a little bit confusing, and you're looking at lots of numbers, probably crunching those numbers in your head, trying to balance out your monthly premiums versus deductibles and all the benefits that are entailed in the plan that you're interested in. And that's why we recommend that you work with a broker. Basically, you can call them, tell them, this is what I need, this is what I can afford, and usually they can help match you with the right plan. Now do make sure to check out our YouTube channel for tons of other informative videos. We have videos about how to save money on health insurance. We have videos about the difference between PPOs and HMOs. We have videos about pretty much everything. And if there's a video that you'd like to see, let us know in the comments below. Thank you so much and have a great day. Bye-bye.